Welcome to our Communiversity Today, a community affairs program from West Virginia University Institute of Technology in Beckley, hosted by Dr. T. Ramon Stuart, president of West Virginia University Institute of Technology, working to make a difference in Southern West Virginia. Guest opinions expressed on this program may not represent the opinions of West Virginia University Institute of Technology or Southern Communications. And now with today's program, here's Dr. Stewart.
I want to welcome you to our Communiversity today. I'm Dr. Ramon Stuart, and I have the privilege of serving as the president of West Virginia University Institute of Technology here in Beckley, West Virginia, and I'm asking you to join me today with two special guests. I have first with us today the Executive Director of the Raleigh County Prevention Coalition, Ms. Kelly Gnau, and I also have in studio with me today Chris Crookshanks. He's a digital creator at WVU Tech. How are you all today?
I'm doing great.
Good. Thanks for having us.
Excellent. So Kelly, tell us a little bit about yourself.
So my name's Kelly. I've been working with the Prevention Coalition for about 3 years. Before that, I worked in foster care, doing policy work. And then before that, I had attended Concord University, where I got my bachelor's in social work and my master's in social work. And I was part of the Modify program that WVU Research Foundation, I guess, oversees. And I am one of a handful of completers of the Modify program, which is for youth who have aged out of foster care for their opportunity to receive the resources that they need, supports to get their college education.
All right. Well, welcome, Kelly. And we have here Chris Crookshanks, a digital creator from WVU Tech. Chris, tell us about yourself.
Well, my name's Chris. I have been at WVU Tech for about 3 years. I think I got there just before you did. And I've been in marketing and communications for about a decade. I was the executive producer over at 59 News. I've worked as the director of PR over at Hospice of Southern West Virginia. I've been in healthcare for a while, and I decided that I was going to get my MSW at WVU.
So now I see the commonality, the MSW.
Yeah, I decided that I was going to pursue that degree because I got to work with a lot of social workers and nurses and doctors, and all those people were just heroes. And I said, no, it's something I may want to pursue. And luckily, my time at Tech has allowed me to explore some other opportunities in the community, and I've had the privilege of being placed on the board of the Prevention Coalition.
All right. Well, certainly, again, Kelly Gnau and Chris Crookshank in studio with us. Ladies and gentlemen, we're going to take a short break, and we'll be back with more Our Communiversity Today on News Talk WWNR in just a moment. I believe that the community should be the university and the university should be the community. And today we stand shoulder to shoulder, Pendleton Community Bank and WVU Tech, not just educationally, but also financially.
Community banks and community bankers build better communities. And so the notion of the Communiversity just came together. I thought, that's exactly what we do. The way I see the role that we play is not only a financial partner, but also an advocate. One that we can advocate for WVU Tech and the mission within the community and how we can work together to both increase financial education as well as traditional education.
I think that not only builds lifelong financial literacy, but it also speaks to the value of a community bank.
As you said many times, when they graduate, we want them to work here, we want them to live here, to play here, and raise a family here. Part of the education process starts early, and we want them to both learn financial education, but also learn that there is opportunities and rewards for doing good as you go forward in life, and always should strive to be your best.
I just appreciate Pendleton Community Bank for stepping forward and saying, not only do we want to be one of the founding sponsors, but we want to continue to help our university and our community, because when we grow, you grow, and when we both grow, this whole area prospers. You meet people where they are, and you help them go places they never dreamed of going.
And now back to our Communiversity today on News Talk WWNR 620 AM and 101.1 FM and online at wwnrradio.com. Here's Dr. Stewart.
Welcome back to our Communiversity today. Again, we're visiting with Kelly Gnau, the executive director of the Raleigh County Prevention Coalition, and Mr. Chris Crookshanks, who's the digital creator over at WVU Tech. And Kelly, when you talked and you introduced yourself and a little bit about your background, I found it very interesting, the role that you play now, and you mentioned you were in foster care. So tell us a little bit more about how you got here.
Sure. So I lived with my grandparents from essentially birth. I was raised in New Hampshire. She had some mental health challenges, and we moved to West Virginia when I was 12. So in New Hampshire, the school system is set up differently. So in elementary school goes up to 6th grade. And so in here in West Virginia, the middle school starts at 6th grade. So when we moved here, it was in the middle of my 6th grade year. So like on a Friday, I was an elementary school student, and then on a Monday, I was a middle school student. And then we were like moving away from everything that
And so how'd that make you feel? I mean, that's too...
It was chaotic. It was chaos. And my grandmother did not raise her own children. So her raising me and my siblings was like, what in the world had I gotten myself into? And so it wasn't until my even adulthood that I realized the issues that she struggled with and needed support for. But we had, Ziploc bags of just pills, and that was normal to me. So once we moved down here, we moved because she had gotten divorced from her then husband, and so she didn't have her own support system for moving down here. So it was she was raised here, but we had been in New Hampshire for years and years and years. So her challenges and me being a teenager and experiencing this huge culture shock, because it is very different in New Hampshire than it is in southern West Virginia. So I'm experiencing this huge culture shock, and so we clash, and I land in foster care. And if anybody knows anything about teenagers in foster care, is that there's not foster homes for them. There's residential facilities for them. And while her and I were experiencing our challenges, it was very much a back and forth of I would be there and then I wasn't, and I was in foster care and then I wasn't. But in coping with that, because I didn't have the relationships, I didn't know anybody here, I was figuring out how to cope with that myself. And so, experimenting with drugs and alcohol.
So how old were you at this time?
So I was 14. I was 13 when I had my first drink of alcohol. I went to stay with my mom in Baltimore, and there was no structure there. So I was out in the streets of the south side of Baltimore. So when I had come back, I found a group of kids at the school. And so by the time I was 14, 15 even, I had drank more alcohol and done more drugs than most adults will experience in their entire lifetime. So I'm very much connected to the prevention work that we do with the youth that in the schools that live here, and I understand a lot of those concepts that we're trying to get out in the community.
So you've walked a mile in many people's shoes.
Yes,
Yeah.
Yes, for sure.
Yeah, and so thank you so much for that. And it's amazing to see that journey you've been on and the things that you've been able to accomplish through the coalition. And, again, we have Chris here. And so, Chris, what is your role with the coalition? How do you build on helping people overcome things like Kelly did?
So I serve on the board of directors as the community representative on the coalition. And
so now let me get this straight.
Mm-hmm.
By day, you're a digital content creator.
Mm-hmm.
and by evening you're working with community partners. Tell me more.
Well, there's a dangerous thing happens when you open your mouth and say there's a problem. And usually if you're near the right people and they listen, they're like, well, come help solve it. And I didn't really appreciate that until I started going into my MSW program and learning more about community action, because something I never appreciated is you really build the community you want to live in. And I think we don't really do that. We kind of throw our hands up and say, well, what's going to happen is going to happen. You don't have to do that. You can go get involved, and you build the town you want to live in. You build the country you want to live in. Your voice is important. And I was lucky enough to say there's a problem in front of Susan Clater, who's the priest over at the Episcopalian Church here, and she took that and informed Kelly that I had a problem with some of the things that were happening here. And then before I knew it, Kelly was calling me saying, hey, you want to come do something about it?
It's really funny that I was on my couch because we had a couple of openings on our board, and I've been trying to fill them with people who are willing to do the work. A common thing in nonprofit is people want to be on the boards kind of for the resume stuff. And so I've been looking for the right people, and I was on my couch and said, oh my God, holy crap, you could be on our board. And he's like, wait a second, I need more information. And I was like, it's fine. This is when we're meeting. You're going to be great. He's like, I have questions. And I was like, okay. But yeah, Chris is fabulous. He gives us a lot of insight into things that we could do differently and look in the big picture. Our board is not necessarily a typical board of directors in coalition work and substance use coalition work. We follow this community level change. So there's 12 sectors that are quote unquote required for certain prevention things, but it's to bring the entire representative from the entire community to the table, so that this isn't just a good idea factory. This is bunch of people who are impacted by this issue and who have a voice at the table. So and now we have all 12 sectors represented on our board, and that's law enforcement, healthcare, youth serving organizations, local businesses, religion. Everybody's at the table having a say-so of how we move forward with this.
So as the executive director, based on your experiences in life and the different things, you're trying to be the change that you wish to see. How does that feel?
Some days I understand why it was so much more difficult for me, because like when you're going through it, you're like, what? This seems simple. We could do these things. And so being able to be part of fixing some of it's the bureaucracy that you have to go through. Some of it is just funding. Some of it is realizing that the adults who are out here serving the youth have their own stuff, and that they're doing the best that they can with what they have. And some of the adults, like everybody has a story. So even like they're doing the best they can with what they have. And sometimes that's a little bit, and sometimes that's a lot. And it goes through cycles. Even for me, like I'm a paid staff, but we go through cycles where our capacity is limited. And so being able to teach that to the youth that we serve of this is what our capacity is, and this is okay that this is what your capacity is, and working through that.
Yeah, I think that's so interesting, Kelly, just knowing where you are and being able to figure out where you want to go. And I think that may be appropriate, as again, we have a digital content creator here in Chris, and being able to tell that particular story. So what I want to do is take a break real quick, and we're going to come back. And Chris, we're going to ask you a little bit more about how your skills and talents help the organization, the coalition, tell that story. And so, ladies and gentlemen, we're going to take a quick break real quick. We'll be back with more Our Communiversity today on News Talk WWNR in just a moment.
Thank you for all of the kind support on Day of Giving at WVU Tech.
Thank you for your donations.
Thank you.
Thank you.
Thank you. Thank you, Nemacolin, for your big heart for hospitality.
Thank you for all your support.
Thank you, Nemacolin.
I'd like to thank y'all for letting me achieve my dreams.
Gracias por su apoyo.
And I just want to thank everybody for their generous gift on the Day of Giving.
Thank you so much for your kind support on the Day of Giving at WVU Tech.
I'd like to thank everyone for their support of Golden Bear Athletics.
Thank you for supporting WVU Tech during our annual Day of Giving.
To all the donors, thank you for supporting our Golden Bears and keep supporting. Thanks.
Thanks for supporting the Golden Bears.
Thank you.
Thank you all for your support.
Thank you for your generosity. It's very much appreciated.
Thank you very much for your generous donations.
Thank you to all the donors for $1 million.
Thank you so much for all your support.
Thank you.
Thank you so much for your contributions.
I'd like to thank everyone that supported us at WVU Tech. We really appreciate every donation. God bless you and continue to support us. We really, really appreciate it. Thank you.
Find out more about how you can be a part of the Communiversity. Visit wwnrradio.com. Now back to the program.
I want to welcome you back to our Communiversity today. Again, we're visiting with Kelly Gnau, the Executive Director of the Raleigh County Prevention Coalition, and also Chris Crookshanks, content creator over at WVU Tech. And, you know, Chris, when I heard Kelly and I heard about her why, and then I look at you and you know, you saying you're getting an MSW, a master's degree in social work. And when you look, how does a master's degree in social work coupled with being a digital content creator help bring about the mission and vision of the Raleigh County Prevention Coalition?
I am blessed to have two different skill sets that I think complement each other in a strange way. People connect with stories before they ever connect with causes. Causes tend to be abstract, and we can talk about something like housing instability, homelessness, substance use, alcohol use, whatever you want to talk about. But until you know the story of a person that's gone through it, it's just an idea.
My grandmother used to always say, Chris, you never know how bad a person's feet hurt until you walk a mile in his or her shoes. And so being able to connect the cause, I think, is big. But Kelly, you know, we've been talking, we know your story, we know Chris's story, but what really is the Raleigh County Prevention Coalition?
So the coalition has been around for 7-8 years now. It started out as a group of people who just wanted to do some sort of level of change, and prevention work is very intentional. So we've grown to where we are today. We follow the strategic prevention framework, the SPIF flower. So in that, all of the sectors come together, and there's a process to deciding what we do. And so you do a community assessment, and then you evaluate the capacity of your community. Are they ready to make this community level change? And so the opioid crisis, everybody knows, is detrimental to West Virginia, and especially southern West Virginia. And so our mission is to prevent the youth who live in this community from getting to a point of crisis, to delay onset, really. So there's a language that's used. The opioid crisis is more of a substance abuse, right? They've used substances of some sort, and now they're abusing them. In prevention work, we talk about substance use, period. Vaping, alcohol, marijuana, prescription medication, using it inappropriately. And so when we evaluate our community's capacity of are they ready, that is where we kind of develop our strategies of how are we going to tackle this, whether it be policy changes in the community, direct support.
So I think this is very important because on this show, our Communiversity today, we want to answer two questions. Why not us and why not now?
Sure.
And so when you pose the question, are we ready to make community level change? Why not us and why not now?
It's about getting everybody together to speak the same message to our community. And we have, in the last year, we are recipients of the Drug-Free Communities grant through the Centers of Disease Control at the federal level. And to do that, we had to graduate the National Coalition Academy. And that was a very intense process that the entire coalition had to go through together. And so when you go through something intensive like that, you band together to implement that.
So it's a we thing, not a me thing.
Yeah, it is very much a we thing. I'm blessed to have two exceptional staff, but our board is active. This is very much not for the weak. Poor Chris, I call him. He spends hours on the phone working through things with us. He does a lot of our messaging and organizing that to our youth.
So Chris, when and now I see the MSW, I see the Raleigh County Prevention Coalition, and I see the digital content creator. How do you help, knowing the challenges that drug and opioid abuse has caused, knowing that prevention and active use and different things, how do you utilize those skills to make sure the message is being conveyed to the community in an effort to unite people?
Communication's all about how you talk to people, and what you say is important. How you say it, I think, is even more important.
So in other words, you don't believe in talking to people. You want to talk with people.
Right. It should be a conversation among our community because, like I said, we shape our community. We have the power to build the community we want to live in. So when you're thinking about prevention, you have to understand that it's a huge ecosystem, and there are unexpected impacts in different places you might not expect. You think about prevention work. The harder we push prevention work, we're also addressing things like housing instability and homelessness, because we know there's direct correlation between substance use disorders and housing instability and homelessness. We're impacting our economy because if we intervene early and we get in front of kids who are at risk because they show this list of risk factors for substance use, then they're more likely to go to college. They're more likely to get higher paying jobs, which impacts the economy in a positive way. It's all interrelated, and understanding that and being able to talk about that is key when you're trying to talk with your neighbors about it.
So as I sit here, I'm hearing you say, why not us? I'm looking at the Raleigh County Prevention Coalition, and I'm listening to the 12 entities that come around the table, and so but why not now? What are the challenges, or what are the opportunities that we have right now to come together to address this? Why not now?
Forever funding. Mm-hmm. With the Drug-Free Communities grant, it's a match grant. So we get $125,000 a year, and it's for 5 years. You get to apply for it a second time for 10 years. It's a match grant. So the community is required to match dollar for dollar.
And is that from the city? Is it from private donors? Is it from the county? What does that match look like?
It could be, it's volunteer hours. So those who are participating, every hour Chris spends on the phone, strategizing, working on things. It's if the city wants to contribute, the county commission wants to contribute, anybody who wants to privately donate goes towards that match.
And so how can private donors get involved?
They could give us a call, 681-539-0370. That number is callable and textable to be able to meet people where they are. That's our whole theme, is to meet people where they are. When we talk about the adults have capacity and youth have capacity, we want to meet people where they are. So our phone number is callable and textable, or they can email me at Kelly Gnau, KELLIEGUNNOE at rcfsc.org, and we'll put you to work.
I love it. I love it. You know, the only time success occurs before work, according to Vince Lombardi, is in the dictionary. And I think he's right. And so, Chris, when you think about the work and you think about the different opportunities for people to get involved, do you have any other ways, tax credits? How does that work?
So, well, first of all, I would say anyone can join the coalition. Anybody. You don't have to be part of the 12 sectors. Any community member for whom this is a problem and they feel like they want to do something, we have coalition meetings regularly. You can join the coalition. You can volunteer. Sometimes that sweat equity is more important than the actual dollars. The other thing is we have the NIP credits. Kelly, what's that stand for?
The Neighborhood Investment Program.
The Neighborhood Investment Program. So, quick summary about the Neighborhood Investment Program. It's a great way to decrease your tax burden, especially for businesses, and also do something to help your community. So you can donate to us. We have a certain amount of NIP credits that we can offer, and if you donate $500 or more, you get 50% of that back on your state tax liability, and you get to write the entire amount off on your taxes.
Excellent. Well, ladies and gentlemen, you see how you can get involved. And when we think about why not us, and you look at the work that Raleigh County Prevention Coalition is doing, and then you think about why not now, and answering the call, helping with resources, and whether it's NIP credits, personal donations, or collaboration with local and state legislators and leaders, there's an opportunity to move now. And so I want to thank you all today for joining us for this edition of our Communiversity Today. Our guest, Ms. Kelly Gnau of the Raleigh County Prevention Coalition, and also Chris Crookshanks, digital creator at WVU Tech and a Master of Social Work student at a local university. Ladies and gentlemen, as you think about what you've heard today, you think about the drug and opioid epidemic that has plagued southern West Virginia. Again, when we ask the question, why not us? We ask and answer, are we ready to make community level change? And when we answer the question of, are we ready to create community level change? And we go into why not now, we must focus on working collaboratively to bring together the resources that are necessary for us to help organizations like the Raleigh County Prevention Coalition and those 12 entities that surround that table to make southern West Virginia a better place. So thank you again to our guests. And for our listeners, please go to our website, wwnrradio.com, where you can find more information about our guests today. And thank you, and see you next week.
You've been listening to Our Communiversity Today, a production of West Virginia University Institute of Technology and Communiversity partner Southern Communications in Beckley. This program and contact information is available on our website and our mobile app at wwnrradio.com. Join us next week for Our Communiversity Today. Find out how you can be a part of the Communiversity family, like Pendleton Community Bank, your bank for generations, the City of Beckley, the Beckley-Raleigh County Chamber of Commerce, Cucumber and Company. Visit Southern West Virginia, the Resort at Glade Springs, and this Southern Communications Station. Find out more at southernwvmedia.com.